So where you are ending, that is the movement, okay? Supination, pronation. Now when you do pronation, this is interesting, you see, in normal anatomical position, when your hand is like this, your radius and ulna are side by side. This is radius, this is ulna, okay, like this. When I do like this, you see this end of radius, the distal end, crosses over the ulna like this. See that? This side is going to the other side, this side is staying here, okay, so it's like cross. So that is pronation. Supine, parallel, pronation, crossover. Okay. Dorsiflexion, plantar flexion occurs in the foot. Now, which one is the plantar surface? The sole or the top? Sole is called the plantar surface, remember, okay? So if I move towards the sole, like this, look at this, towards the sole, this is your foot, this is the sole of the foot. If I move towards the sole, that is called plantar flexion, make sense? And this is called the dorsal surface of the foot, the upper surface. So dorsiflexion. So if you stand on your heel, like this is what? What movement is this? Dorsiflexion, make sense? This is dorsal surface. If I stand on my toes, what is this? Plantar flexion, make sense? Dorsiflexion of foot, plantar flexion. Okay. In anatomy, if you know one, another becomes very easy. Look at this. We already know this is dorsal surface of the foot. This is plantar surface of the foot. Make sense? So once you know that, this is what? Dorsiflexion, plantar flexion. Okay. Inversion, eversion. Again, this is your foot. If you move the sole towards you, inwards, that is called inversion. That means, look at this. This is your big toe of foot. This is your big toe, right? So if you move the big toe upwards, sole will move inwards, right? So that is called inversion. Big toe up, inversion, like this. Like this, inversion, right? And opposite is eversion. Protraction, retraction. Have you seen protruded mandible? Sometimes you see in few people, the mandible is pushed like forward, protruded, right? So that is protraction. If the part moves outwards, that is called what? Protraction. Example, protruded mandible. I can do that, right? I can move my mandible forward and backward, right? This way. So, protraction. And retraction is what? Taking backwards. Have you heard retraction, the word? I think so, yes. We have retracted soldiers from the battlefield. Probably you have read in the newspaper, right? Retracting. Pulling back, taking back. So, moving outwards, protraction, pulling backwards is what?
Retraction.
Retraction. Retracting. Elevation, depression, very simple. Look at me. When I open my mouth, my mandible moves down, right? So that is depression. When I close my mouth, moves up, elevation. So in some movements, the bones move ups and downs. So, depression and elevation. So now if you see all these pictures I have shown you, it will be easy. You see here, supination, pronation. Okay. Now we'll talk about a couple of large synovial joints. So you'll get some idea. Large synovial joints are knee joint, elbow joint, shoulder joint, and hip joint. Those are large. And knee joint is called the most complex joint of the body. Why? Because in knee joint you have inside the knee joint, you have multiple joints. You see here, 1, 2, 3, 4 bones are here, right? So a number of joints together form the knee joint. That's why it is a complex large synovial joint. Inside the knee joint, you have 3 joints. One is femoropatellar joint. You see here, this bone is called patella, kneecap. This is called what? Patella. And this is the, which bone is this? The big one. Femur, right? So here, the patella gets attached to the femur. That's why you have a smooth surface here. And that joint is called femoropatellar joint. Most of the joints are named after the bones. Okay? So femur and patella, femoropatellar joint. That is one, right? And now, you see, at the lower end of femur, you have 2 big condyles. And these 2 condyles get attached to the upper end of tibia. This is the tibia. Also has 2 condyles. So 2 condyles of femur articulate with 2 condyles of tibia and form 2 other joints, lateral and medial tibiofemoral joints between tibia and femur. Tibiofemoral joints, lateral and medial. So those 3 joints together form the knee joint. That's why it is called a complex joint. Now, if you see the structure of a knee joint, it is a synovial joint, right? It is a synovial joint. So let's first see the structures you're supposed to see in a synovial joint. Mention one structure. I did draw the synovial joint here. What you're supposed to see? Cavity, right? Filled with fluid, right? So the bones are not attached to each other. There is a cavity. So you see here, this is the synovial cavity. Make sense? Now you tell me, the bones are covered by what kind of cartilage? Hyaline. That is called articular cartilage, right? So you see, the bones are covered by articular cartilage. Is it clear? So those 2 things we can see here. Now the bone or joint is surrounded by what? Wrapped by capsule. So you have the capsule. You see articular capsule or joint capsule. Make sense? So you see all those structures. Now I said, in some synovial joints, you have fluid-filled flattened sacs. Those are called what? Bursa. Remember that? So, in your knee joint, you have a number of bursa. Okay? Between the skin and the joint, between the ligament and the joint, right? So, what are those bursa? You see here. These are bursa. Okay? This is called the patellar ligament, and this is the bone. So, in between, you have that bursa. That is called suprapatellar bursa. Its name makes sense. Supra means what? Above or below? Above. The patella. That's why it is called suprapatellar. Subcutaneous bursa is another one. Sub means what?
Below.
Below. Cutaneous means what? Skin. So under the skin, you have this bursa. Make sense? That's why it is called subcutaneous pre-patellar, before patella. You see, if you go this way, it is before the patella. But under the what? Skin. Make sense? So subcutaneous pre-patellar bursa. Infrapatellar bursa. That means below the patella. Infrapatellar bursa. Make sense? So you see suprapatellar, subcutaneous, under the skin, and infrapatellar bursa. So those are some bursa around the knee joint. And they reduce the friction. Okay. Now, inside the synovial joint, knee joint, we see cruciate ligaments, anterior and posterior cruciate ligaments. Also, around the knee joint, you have a number of ligaments outside. From the quadriceps muscles, this tendon gets attached to the patella. That means between the muscle and the bone. That's why this is called a tendon. Tendon connects muscle to the bone. Remember, tendon connects what? Muscle to bone. So that's why that is called a tendon. Tendon of quadriceps muscle. Quadriceps femoris muscle. Same structure you see here. Below the patella, exactly same, structure. But below the patella, it connects the patella to the tibia. That means bone to bone, not muscle to bone, right? That's why it is called a ligament. So ligament connects bone to bone. Okay. Although structure is same, but one is connecting muscle to the bone, that is called a tendon, right? The one connecting bone to bone, that is called what? Ligament. And this is called the patellar ligament. I believe you have heard this. This has a significance when you go to your doctor. Sometimes, doctor asks you to sit, relax, and uses what? A small hammer, right? To tap on the patellar ligament to see knee jerk, knee reflex, right? So we hit the patellar ligament to test the knee reflex. Okay. Now that is the front. Now if you see the side, at the side you have retinaculum in both sides. This is the lateral side, remember. Fibula, smaller one, thinner one is the lateral bone, tibia is the medial bone. So anything in this side is lateral, right? Anything in this side is medial. Make sense? So lateral retinaculum, medial retinaculum. Fibular collateral ligament because it is attached to the fibula. Tibial collateral ligament because this is attached to the tibia. So retinaculum and collateral ligaments. In tibial side tibial, fibular side fibular. And fibular side is lateral, tibial side is medial. Now, if you see inside the knee joint, the bone is covered by articular cartilage here. That's the hyaline cartilage. But also in knee joint, this is an exception. The articular cartilage is surrounded by a fibrocartilage, and that fibrocartilage is called meniscus. So the articular cartilage covers the bone, but around the articular cartilage, which is around the articular cartilage, you have also fibrocartilaginous structure that is called what? Meniscus, fibrocartilage. So meniscus is a fibrocartilaginous structure. Where else you found fibrocartilage? Remember that? Symphysis joint, fibrocartilage. Pubic symphysis, fibrocartilage. So intervertebral discs, pubic symphysis, as well as meniscus of your knee, right? Those are fibrocartilages. Here you see, this is fibrocartilaginous, and hyaline cartilage is here. So hyaline cartilage sits here, and fibrocartilage around it. Now, torning of meniscus is commonly heard. Have you heard it? Torning of meniscus in sports, right? Particularly certain sports we hear torning of ligament, torning of meniscus, right? So that can happen in the knee joint too. So replacement of meniscus is done also. So that's the knee joint. Now shoulder joint, this one is also a synovial joint. It is a ball and socket type synovial joint. Why? Because in this type of synovial joint, you see, the head of the humerus is a ball, like round, and glenoid cavity here in the scapula is a socket. So, ball and socket type synovial joint. Ligaments in the shoulder joint, you have three types of ligaments: coracohumeral, coracoacromial, and three glenohumeral ligaments. Now, if you, as I said, if you know the bones and their parts, it becomes easy to remember. First, see coracohumeral. This bone is what? Humerus. And this part, you see, of the scapula, this piece, is called coracoid process. Coracoid process. Now, it is easy. Coracohumeral ligament will connect what? Coracoid process and humerus. Make sense? Like this. Next, coracoacromial. This piece of scapula is called acromion. And this is coracoid, right? So, the ligament is like this. Coracoacromial. So, if you know those parts, it's really easy, right? Just name that connecting those two. Now, glenohumeral. Again, this is very easy if you know. This is called the glenoid cavity here of the scapula. So, gleno, we know this is humerus, right? So, glenohumeral. There are three actually, glenohumeral like this, connecting the glenoid to the humerus. Make sense? So, coracoacromial, coracohumeral, and glenohumeral ligaments. Those ligaments hold the bones, support the joints. Okay. Now, if you see the shoulder joint, this is the glenoid cavity, and this is the head of the humerus, and this is the synovial cavity filled with synovial fluid, and these are bursa, flattened fluid filled sacs. Shoulder joint, you see, this glenoid cavity is not very deep. If you look at this, it is a shallow cavity like this. It is not really deep like this. It is shallow cavity, and this is the head of the humerus. So, the head of the humerus is not very strongly held there. Make sense? Because the cavity is shallow like this. So, the chance of the head of the humerus coming off is very high. Make sense? In your hip joint, you look at this. This is the acetabulum, the socket is really deep. So this is the acetabulum, this is the head of the femur. Very strongly held. Cannot easily, take it out. But here in shoulder, the cavity is shallow like this, head, so it can easily come out, right? So shoulder dislocation, have you heard, is commonly heard, right? In sports, shoulder dislocation, because of that shallowness. So articular cartilage covers the bones, you know that, at the joints, hyaline cartilage. This is an important bursa, subacromial bursa. I told you before, this is the acromion, and you have a bursa here between the head of the humerus and a ligament attached to the acromion. So under the ligament. So that is the coracoacromial ligament, coracoacromial ligament here. That bursa, subacromial bursa. So that helps in movement of the shoulder joint and reduces the friction between the ligament and the bone. Those are the ligaments: coracohumeral, coracoacromial, and coracohumeral, and glenohumeral ligaments. Okay, so those are two large synovial joints. You have learned about those. Now, inflammation of the joints. Sometimes what we see, inflammation occurs in soft tissue structures. Soft tissue structures in the joint. If inflammation occurs in soft tissue of the joints, like capsules or ligaments, that is called rheumatoid arthritis. Itis, inflammation. Okay. Rheumatoid arthritis is the inflammation of soft tissue structures in the joint. Sometimes we see many tiny holes or pores is formed in the hard tissue, that means in the bone, and that is called osteo means bone, poresis. Osteoporosis. Pores in the bone, osteoporosis. This happens in older women after menopause because lack of estrogen, the female sex hormone, can cause that osteoporosis. That's why we see in older women more. There are other factors, but that's the one main factor, lack of estrogen. Make sense? Okay. Rheumatoid fever. Sometimes, this is a bacterial infection that can go from the joint to the heart and can affect the valves of the heart, and the valves become dysfunctional or non-functional gradually. That is the rheumatoid fever. That also another clinical condition. So those are the things you need to know about the joints. Okay? Stop here.